Everybody good?
Okay, good morning, everyone. I am Denise Johnson, the Acting Secretary of Health and Physician General at the Pennsylvania Department of Health. It's really great to be here at the Dauphin County State Health Center. They are hosting vaccine clinics, and really proud of the work that our community health nurses have done. Our community health nurses have been busy all during this pandemic, and they've been here at the health center doing vaccines, including the pediatric preschool vaccine. Our state health nurses also have been really critical in our COVID efforts, and so I'd really like to thank all of them for the hard work that they continue to do. Here at this health center, as I said, we are doing the preschool pediatric vaccines. Those vaccines are done here every Wednesday, and it is walk-in, so you don't have to have an appointment. The Department of Health has been working with providers all across the state to make sure that vaccines are available and accessible in every community across the Commonwealth. We want to make sure that individuals have what they need to keep them safe and healthy. And at this health center, not only are vaccines available, but you also can have access to testing and treatment for COVID-19. In terms of the preschool pediatric vaccine, I know that many of us have been waiting for that for a long time. And so parents and teachers and families have been waiting for the vaccine, and now it's here and available. The preschool pediatric vaccine is a smaller dose than the vaccines that teens or adults get, and based on the vaccine that you receive, you may need 1 or 2 doses. As a physician and as the Acting Secretary of Health, I strongly encourage individuals to get their kids vaccinated. Even if your child has had COVID infection before, we still strongly recommend that vaccination. We know that the vaccinations are strongly protective against severe illness with COVID-19, as well as hospitalizations, and so we want to keep our kids safe and healthy. Also for adults, we want to make sure that you're up to date with your vaccination. So if you're eligible for a booster and have not gotten that booster yet, we encourage you to get that because, again, it still provides excellent protection against severe illness and hospitalizations for COVID. So again, vaccines are accessible. They're available here. You can get your children vaccinated 6 months and older here every Wednesday. No appointment needed, just walk in to get those done. So really encourage you to take advantage of that protection. Now I'd like to turn it over to my colleague, Acting Secretary at the Department of Human Services, Meg Snead.
Good morning, and thank you, Acting Secretary Dr. Johnson. My name is Meg Snead, and I'm the Acting Secretary of the Pennsylvania Department of Human Services. I want to thank the Department of Health and the nurses from the Bureau of Community Health Systems for hosting this vaccine clinic. DHS is proud to be here today as a trusted community partner that is increasing vaccination rates here in Harrisburg. I'm a mom to 2 kids under the age of 10, and my youngest recently became eligible for the COVID vaccine. I can't tell you how happy I was to take her to the doctor to get vaccinated after more than 2 long years of living through the uncertainty of this pandemic. As a parent, you want to do everything you can to protect your kids and keep them safe. I want my kids to be able to just be kids, to enjoy school and activities with their friends without having to worry about contracting COVID. By vaccinating my kids, I'm sending them off to school this fall knowing that they are as protected as possible from this virus. DHS works hard to ensure that all of Pennsylvania's kids are healthy, safe, and thriving. We license childcare and early learning centers that help them learn and grow in the years before kindergarten. Childcare and early childhood education providers are an important part of the caring infrastructure, and they are essential, especially over the last 2 years. As a mom, when my children were not vaccinated, I recall the frustration of having to stay home to quarantine when they had an exposure to a confirmed case of COVID. By vaccinating our children, they can now potentially avoid time out of school or daycare. I encourage all child care providers to get vaccinated and boosted to keep themselves, their families, and the kids in their care safe. You have an important role to play in stopping the spread of COVID. When you get vaccinated and boosted, your chances of severe infection, hospitalization, and death from COVID-19 are greatly reduced. And by getting vaccinated, you are helping limit potential transmission to our family, friends, and neighbors who may be at greater risk of a more harmful case of the virus. COVID-19 vaccines are free, effective, and safe. If you're hesitant, talk to a trusted healthcare provider. They're here to help you keep you and your loved ones safe from COVID-19. Thank you again for having DHS be a part of this visit today. I'm happy to turn it back over to Acting Secretary Johnson.
Thank you very much, Acting Secretary Snead. And we would be happy to take any questions that you have about today's event. If there are questions that you have off topic, we ask that you leave those to the end. But right now, we're welcoming any questions.
Secretary Johnson, can you talk about the adoption rate for not only this newest available vaccine for the youngest children, but also where you're seeing it at school levels? 5 to 11. And I asked that, are you satisfied with the adoption rate at this point, especially with the school coming back, in a matter of weeks for a lot of children?
Sure, thank you. Well, as I've said before, these vaccines are safe and highly effective, and so we really would recommend that everyone get vaccinated. So we certainly are not seeing the uptake that we would like to see yet. For the preschool pediatric vaccine, that uptake has been slower than the other vaccine for kids 5 and older. And that's what we're seeing nationwide. Some of it may be a convenience factor, or kids are not getting ready to go to school yet, so some people may be waiting. But we encourage families to get vaccinated right away and not to wait. You want to get that additional level of protection right away. So that's why we're making sure that people know that the vaccines are available, because we'd like them to not wait to get vaccinated.
And how long does it take for people who are maybe just don't know? How long does it take to get that immunity from the vaccine?
So based on the vaccine that you get, you need to complete your series of vaccine to get the full protection. So for the Pfizer vaccine, it's 3 doses of the vaccine. For Moderna, it's 2 doses. And so the full immunity is 2 weeks after you've completed your series.
Just given that the second booster is not available to the general public just yet, it sounds like a lot of people. Are you frustrated with the amount of time it's taken to get there? Because I know that we've seen this new subvariant that's been causing a lot of spread right now. There's been other concerns, I guess, just with waning immunity. Are you a little frustrated that it's taken this long to get that second booster approved for the general public yet?
Well, I think that we still need to remember that those who have not been vaccinated at all are the ones that are most vulnerable. We know that these vaccines are still protecting us against severe illness and hospitalization, and so that even those who have not gotten a second booster are still well protected. Don't want people to believe that if you're 50 years and younger and you've had your first booster, that you're not protected, because you really are.
Speaking of schools, with children in their health card, would this be a requirement, such as they have to get the measles shot? Could we see this being a requirement in the schools for kids getting these vaccinations?
So right now, it is not a requirement. I've really not heard of any conversations of making it a requirement at this point. So nothing at all that I've heard in conversations.
Okay. And there's this word that's been spreading around, endemic. A lot of people are talking about this. Is this a step to the endemic, or what would you say, are we at an endemic?
So I think that's really difficult to characterize. I know that there's been a lot of discussion about what endemic really means. Certainly, I think COVID is not going away anytime soon. We're going to continue to have to live with it. I think that we've seen really ups and downs in terms of surges, and so I don't think we've had enough time to know what the steady state of COVID will be. It doesn't seem like we're there quite yet, because we still have quite a bit of variations in what we're seeing.
All right, and just to clarify the ages, the Pfizer, that's for ages 5 and above, and then Moderna, or are they both for 6 months and above?
So we have several versions of the vaccine. So there's an adult version for the Pfizer. I believe it's 16 years and older, and for Moderna, 18 and older. But we also have vaccines for age 5 and older. And then we have a preschool pediatric vaccine that is for 6 months and older. Our staff is really well trained to know what type of vaccine is needed for individuals. And so they're very meticulous about making sure that individuals get the correct vaccine for them.
The pediatric vaccine, who's that by?
There are preschool pediatric vaccines by Moderna and Pfizer.
Thanks.
Secretary, why do you think you're not seeing the adoption rate for pediatric vaccines at the rate that you would like to see? What do you think is driving that, especially in some communities where it really hasn't, in some counties where it really hasn't been substantial?
Well, I think there could be many reasons. Some of them may be that individuals don't see the urgency. And so we've had COVID around us for quite a while, and many people are recovered from infection. And so even though we recommend getting the vaccine after you've recovered for a higher level of immunity, some may not see the urgency in getting that vaccine. Also, some may not understand how severe this illness can be in children. And so, although children seem to get less severe illness, we have children who were hospitalized. We have children that we've lost in Pennsylvania to COVID. So it is, children are not completely excluded from severe illness and hospitalization with COVID. And so that may be some of the hesitancy.
Could they be carrying, like, injury might not be the right word, but long-term consequences if they get sick when they're really little, let's say, and then they might have to live with that the rest of their life?
So we are still learning more about long COVID. We certainly know that individuals who have had COVID and recovered can have some long-lasting symptoms. COVID's not been around us for very long, so there's a lot more that we're continuing to learn. But we know that the vaccines are highly protective, and so we do recommend them strongly. Yes?
Despite people not taking up the vaccine for children, how significant is it having this vaccine available for children and kind of just fighting COVID? How significant is this moment that we're able to finally pass out vaccines for children? Because I know someone personally that has been hiding their kids, hasn't been allowing their kids to play outside with people yet. So I mean, I know people aren't really adopting it yet, but how significant is it that we have this available?
I think it's outstanding. Before we had vaccines at all, I know that many of us, especially the medical community, were very anxious about ourselves and our families. And when vaccines were available to us, we were the first in line to get vaccines. I know that there have been many families that are concerned about taking trips with their families, getting their kids involved in activities because they didn't want their kids to get severely ill, and they didn't want their kids to cause an illness in a vulnerable family member. So it's phenomenal that we have these vaccines, especially since they've been proven with hundreds of millions of doses that these are very, very effective and very safe, and so highly recommended. Okay, great. Thank you all very much, and recommending everyone come out, bring your kids, get vaccinated, and enjoy the rest of your summer. Thank you.
Used to have a ton of them in my bag now.
Oh, no, you're fine. Yeah, we're in the back, so you can.
Thank you.
Just came a little early to make sure everything was set up. Stephanie Goodling.
Let me get a quick shot of that real quick.
Acting COVID. By vaccinating my kids, I'm sending them off to school this fall knowing that they are as protected as possible from this virus. DHS works hard to ensure
That people know that the vaccines are available, because we'd like them to not wait to get vaccinated.
And how long